So it is my pleasure to introduce to you Ann Van Duzen, who is going to be moderating the next plenary session for us about keeping girls in school. Ann is the advisor to the leading domestic and international donor institutions on strategic planning, program development, and also evaluation. She has spent her career working on issues of economic and social development, humanitarian assistance, and poverty alleviation, both internationally and domestically. She is the Chief Operating Officer of Save the Children. She has served as the Chief Operating Officer of Save the Children and is the Interim Chief Executive Officer of Enterprise Works. She is active in many charitable organization and is the professor and lecturer at Johns Hopkins School of Advanced International Studies and an adjunct professor in the School of Foreign Service at Georgetown University. She has published on social indicators, health and poverty, women and family in the Arab world. She is a PhD from Johns Hopkins University, an MA from Johns Hopkins School of Advanced International Studies, and a BA with honors from Wesley College. So with that, I would ask you to please welcome Ann.
Thank you very much. I think you're in for a treat this afternoon. We're going to be focusing on some of the social and cultural aspects of urban life, and with a particular focus on education and young girls. Now, I'm sure over the course of the conference, people have talked about the rapid explosion in cities around the world. But just to put it in perspective, 60 million people a year move into cities. And this kind of growth in cities is going to occur for the next 30 years. So you have very rapid movement. Already more than half the world's population is now living in cities. Over the next 15 or so years, many cities in Asia and Africa are going to be doubling in size. And we know, from 1/3 to 1/2 of the population there are living in slum areas, and the urban infrastructure just cannot keep up. Just to put it in perspective, about 20 years ago, I was involved in international health programs, and there was a big effort to try and get 80% of the world's children immunized with basic childhood immunizations. And the hardest to reach groups were not in remote rural areas at all. They were in the new communities in cities, people who in many ways were off the grid, who didn't have access to clinics, and people didn't know they were there. And very much the same thing can be happening in urban settings today in the area of education, health services, whatever. Now, many people say girls have better access to schooling in urban areas than rural areas. And in general, that's true. But as we will hear in our panel today, there are a number of challenges. And today, well over half of the children and adolescents who are not in school are girls. And we'll talk a little bit about some of the reasons for that. Again, just to keep this in perspective, 1 out of 5 girls in the developing world doesn't complete 6th grade. Even if they start, they don't complete there. Only 43% of secondary age schoolgirls are actually attending secondary school. And just to take a look towards the future, towards the university, only 10% of girls who enroll in primary school actually make it to university in the developing world. And this is where the talent and the teachers are going to come from. So there's a huge challenge and a lot of interest in what you can do, not only to get girls into school, but what you can do to overcome the barriers so they stay there. And we will be talking about some of the economic and social and cultural barriers, and in particular, the role that the onset of menstruation plays in basically denying opportunities for girls to stay in school. I could go on and on about the economic benefits of educating girls. I suspect you know that. And the political benefits, in a sense, there is such a replete literature on the value to educating girls that you wonder, why are we still talking about it? But just on the sort of macroeconomic level, a recent study by the World Bank basically estimated that the world is losing $92 billion a year just because of gender disparity in schools. That is, if you could equalize girls and boys' participation and completion of primary school, just the first 6 years, it would result in $92 billion more to the economy and the society. So we're not talking about small change here. I will stop, and it's my great pleasure to introduce the speakers. I propose to introduce them as they speak, and we will try to keep to the time limit for each speaker so that we have plenty of time for discussion, because I am certain that you're going to have questions and comments. And do remember the yellow cards, because if there's ever an action agenda, it should be here. So our first speaker is Verena Chanoten. I think I almost got it right. Verena was born in Suriname. She is, or has been, a Dutch politician who was in the Dutch House of Representatives from 2003 to 2006. And while she was there, she really was the spokesman for development cooperation, and really the advocate for women, children, immigrants, and the disabled, the people who need advocacy. She's an expert, certainly on the negative aspects of the lack of sanitary napkins and other hygiene protection on women in developing countries. Her training, she has a bachelor's in law, a master's in clinical pedagogy, and a PhD in social sciences. So she has a very well-rounded education background as well. She has been managing director for the Foundation on Work and Enterprise, and managing director of the Regional Office for Multicultural Development in Eindhoven, and project manager of the Institute for Multicultural Development in Utrecht. And she's currently teaching at the Hague University. So it's my pleasure to invite Verena to speak.
Thank you, Mrs. Chair. Is the microphone okay? Okay, thank you, Mrs. Chair. Ladies and gentlemen, good afternoon. I hope you had a good lunch. I enjoyed it. I see that Mrs. Avaf is coming in. Thank you as well for joining us. You know, if you were one of my students, I would have said, good evening. Let me start. Good evening to you. Let me start with congratulating the organizers of this Congress, that they've taken the initiative to focus on women's health within an urban context. As more of the world's population is living in urban areas, focusing on characteristics of cities that affect health has the potential to improve the understanding of people's health and to guide effective interventions. Let me also thank Procter & Gamble, in particular Anne Hoogwald, to give me the opportunity to participate in this conference and to address such a distinguished audience and deliver the lecture on the education of girls in developing countries within the framework of their sexual and reproductive health. You know, the issue how to ensure that girls in developing countries not only enter school, but also how to keep them in schools when they reach puberty is not from yesterday or from 2003, when the former United Nations Secretary Kofi Annan said, and I will quote, "The first step for societies is to recognize that educating girls is not an option, it is a necessity." Jane Austen, an English novelist who lived in the 18th century, emphasized the importance of girls' education almost 200 years ago by saying, and I quote, "Give a girl an education and introduce her properly into the world, and 10 to 1, but she has the means of settling well without further expense to anybody." A true word. No one knows better than all of you that educating girls has a positive impact on gender equity, child and maternal health, reduction of birth and mortality rates. More speakers spoke about several aspects, so I will skip them. In fact, hundreds of studies have shown that educating females is one of the most effective weapons against poverty. As mothers teach their daughters in Suriname, the country where I was born, educating is your husband, your life, and your health insurance. Why don't we use this life-changing weapon to improve the quality of life and empowerment of girls and women to the max? Women and girls are willing to be full participants in their societies and economies and contribute to the socio-economic development of their countries. The loss of productivity on national, community, and family level, especially in countries that work hard on rebuilding their nations and on the recovery of economic growth, is unacceptable. The causes are best told by the different barriers that girls and women in development countries face in the social, economic, cultural, and religious spheres. Let's start with the most important barrier, poverty. Many poor families cannot afford to send their daughters to school because there are not enough means to afford school fees, transport costs, or buy school uniforms or other school supplies. And even if the costs of schooling are cut by eliminating school fees and abolishing compulsory uniforms, and parents are convinced that education is a vehicle for a better life, they are afraid to send their daughters to school because girls run a higher risk of becoming the victim of sexual violence and abuse. Having someone to accompany their daughter on her way to and from school costs money. Money families rather spend on primary needs like clothes, food, water, or paraffin. Another challenge is that parents in many developing countries don't have the obligation to enroll and send their children to school. Compulsory education is lacking, and where any form of compulsory education exists, it is often circumvented because of the lack of control to enforce compliance with compulsory education. In relationship with this, there is a more pressing problem to deal with, a problem that has to be solved. Many developing countries don't have a proper registration system for birth, marriage, and death. Children without a birth certificate don't exist officially. They don't have access to basic social facilities such as health and education because they are invisible. This could result in an endless, if not impossible, task of monitoring compulsory education. More importantly, these invisible children are not included in the statistics used by their governments to outline policies and make strategic and significant investments in programs. Another barrier for not sending girls to school is that families often rely upon their daughters to fulfill household responsibilities, look after siblings, and prepare them for the future role as a wife and a mother. Without the girl's contribution to domestic work, a father in a village in India told me, when talking about the education of his daughters, we will go to bed more often with an empty stomach. A challenge many parents in developing countries also face if they want to invest in their daughters' education is gossip and social criticism from their community and religious leaders. This applies in particular to those communities with very traditional gender-specific roles where, quote, quote, appropriate social behavior is to invest in a male child as the future breadwinner and a guarantee for a good old age, and where it's taken for granted that a girl would eventually get married and leave her family to live with her husband's family. You know, as a former politician and spokesperson development cooperation in the Dutch Parliament, I had the opportunity to travel to many countries representing the Netherlands. During the visits to developing countries, whilst visiting schools and communities, there was one striking observation I made. There were no major differences at preschool and early primary school level between boys and girls' attendance, but in the higher forms of primary, grade, and secondary school, the number of girls was reduced almost by half. To my question, why the participation of girls in the higher classes of primary and secondary education lagged behind that of boys, all the barriers I mentioned were given as explanations, sometimes issues like lack of clean and safe and private toilet facilities, clean running water, and the gender-unfriendly school culture and infrastructure were mentioned as well. Yet, it was very hard for me to accept that these factors were the only truth for the low school attendance of girls in higher forms of primary and secondary education. My intuition, and it's good to hold on to your intuition, told me that something else, something very basic, played an important role in the non-participation of girls in schools. In Ethiopia, a teacher who had worked for many years in England, who after her retirement returned back to her country, answered my question by saying that the lack of affordable and accessible sanitary protection products was an important reason for the changes in school participation of girls. For some girls, it meant that they were married off immediately after their first menstruation to ensure that they did not dishonor their family by getting pregnant. For other girls, it meant that they could no longer go to school permanently or temporarily during the days that they were menstruating. You know, I was shocked because as a woman, I did not even think about the fact that menstrual hygiene presented such a problem for girls and women in developing countries. This also made me realize that part of the problem has to do with us, women. We'd rather not talk about it. And if we feel that we have to give an explanation for the absence from school or work, or we have difficulties in carrying out duties when menstruating, we use non-specific veiling expressions, euphemisms such as, I'm not feeling well, I have stomach cramps, that time of the month, or we have aunts, grandmothers, monsters, devil visiting, we have red flags hanging out, and we have monthly celebrations. And with that, you know, we cover up such an important indicator of female reproductive status. Kofi Annan recommended the General Assembly in 2006 in his report on the work of the organization to add the reproductive health goal under Millennium Development Goal 5. However, menstrual hygiene in management is no part of reproductive and preventive health programs, and the challenges faced by girls and women in developing countries, especially in the rural areas, because of a monthly returning phenomenon called menstruation, is hardly recognized. You know, in my opinion, politicians, programmers, policy and decision makers had the opportunity to ignore this issue and not to take responsibility for the impact of it on the lives of girls and women. Not only because they mostly are men, do you really think that those responsible for allocating money will have the ambition to interfere when we women shroud ourselves in shame and secrecy about the most powerful symbol of sexual maturity and fertility, and give them the ammunition to place menstruation into a category of issues which are too complex, not too sexy, too culturally loaded, too social, too feminine, or too inattractable? Or as one of my male students from Nigeria said, you know, teacher, we don't talk about menstruation. Men don't do that. It's woman stuff. Therefore, my first recommendation is let us stop limiting ourselves and our behavior by taboos and start an open dialogue about all aspects of sexual and reproductive health of girls and women, including menstruation and menstrual hygiene. Not only with women, but especially with men. Women's issues are men's issues. That's why I ask you women to applaud all the men who are in this room to be with us. Let us stop to portray menstruation as an hygienic crisis and consider sexual education by adults, and I mean guardians, teachers, parents, as a no-go area. Let us support those men and women in developing countries who want an upfront approach to talk about sexuality, also within the framework of education, without losing track of the deeply embedded and persisting cultural traditions and customs. Or, as the lawyer of Amina Lawal, the Nigerian woman who was convicted of adultery and sentenced to death by stoning, said, when I spoke to her, I was glad with the support of women from all over the world, but I had to solve this case within the context of my own culture, a culture I know best. You know, the UN Convention, am I still in time? No. Oh my God, do I have to end?
Wrap it up in the next 2 or 3 minutes, that would be great.
Okay, so I will skip, I will, okay. I will start doing this. You know, there is the UN Convention of the Rights of Children states that every child has the right to education. It was underlined during the Millennium Summit in 2000 by the Millennium Development Goal 2 and Millennium Development Goal 3. Now, the convention also states that children have the right to enjoy the highest attainable health and the right not to be discriminated against. And in spite of all these rights, the obligation of full development of the human development within a safe school environment and the responsibility of prioritizing the acquisition and reinforcement of values such as the sense of dignity, self-worth, and respect seem to be teethless tigers for many girls during their menstruation. Because girls lack adequate support and guidance during menstruation. Okay, but what happens when the priorities and needs of girls are driving forces, for example, in school design and in school infrastructure, which means, amongst others, appropriate and adequate sanitation facilities? What happens when girls are provided with sanitary pads, and as a consequence of which they don't feel embarrassed or anxious of staining their clothes with blood and being teased by boys? You know, there is conclusive evidence that girls' attendance at school is increased through improved sanitation. Confirmation is also given, say with some reservation, that in a recent not published study from the University of Oxford, that free sanitary pad provision to girls has a positive impact on school attendance and the participation of girls. I'm almost finished. Menstrual hygiene has the growing attention of women and women's organizations in development countries. Girls want and women want to exercise and enjoy their human rights, including the right to education, health, and privacy. They want to systematically address all relevant areas to tackle women's issues, amongst others, gender equality in their own country. The burden of the lack of sanitary hygiene protection material, as a result of which girls and young women cannot participate in school when having their menstruation, can be lifted when they have decision-making power over events and situations that affect their lives. However, to have the power to participate on economic, social, and political level, girls and women need to be equipped by receiving formal education that will prepare them to participate fully and actively in society. Chair, I'm almost finished. Breaking the vicious circle of girls and women, of poverty, illiteracy, and incompetence to contribute to the development of their country successfully does not imply a quick technical fix of providing girls and women with sanitary napkins or formulating a new policy framework. It means adjusting the angle, refocusing and a degree of reallocation of resources within existing educational and health programs. It calls for hard-headed courage and immediate action of various stakeholders, politicians, of course, but also including the femcare manufacturers. And I'm not going to mention all. No one-size-fits-all solution or business as usual, and no satisfaction with partial success. Statements, and I heard them like much has been changed already compared to the past, are unacceptable as long as girls and women cannot exercise and enjoy their rights, especially their fundamental rights. Policies are failing, and that's where we need connection and action. Ladies and gentlemen, this is one of the problems of former politicians and politicians. They talk too much. Ladies and gentlemen, let's take our responsibility and face the pressing challenge of addressing the issue of menstrual hygiene and menstrual management. Girls and women in development countries can make a difference, and if they're provided with equal opportunities to participate in schools by providing them, amongst others, with affordable and accessible menstrual hygiene material. Chair, just one remark, just one small remark. At the end, and this is a very short remark, in development countries, the poorest of the poorest, and this is a cry from my heart, are the people with disabilities. Don't forget, women with disabilities menstruate as well. Don't exclude them, but include them in your plans and your campaigns. Thank you.
Thank you very much, Verena. We'll try and catch up on the time. But that provided a wonderful context for the next speakers, who will be talking about some very specific programs and efforts to address this issue. The next speaker is Brad Kerner, who's an international public health specialist whose whole career has focused on adolescents' sexual and reproductive health and HIV/AIDS, specifically focusing on youth. He sort of straddles the education health divide, but currently and since 2005 he's been at Save the Children, and he is now providing technical assistance on a variety of youth-oriented programs that Save the Children is running, looking at community-based distribution of family planning services, school-based puberty education, and a variety of other programs that are directly relevant to our conversation today. I have a list of the countries where he's worked, but it's a long list, so more than 13 countries. Brad.
Thank you. I'll look over here. I'll keep my eye on my timekeeper. First, I just want to say how privileged I am to be here in front of this room of experts, and how proud I am to be in the minority and be a man that truly is passionate about the health and well-being of women, and in particular, adolescent girls. And I also want to say I'm bringing you to the drugstore next time I have to go pick up my wife's feminine hygiene products, because that'll be great. Before I start, I actually want to pick up where the last plenary session ended, and I think Susan Purdon gave a great segue to our topic. And I do want to show some of the links between reproductive health and education. We've all heard how education is a social vaccine. And I want to remind everyone that the leading cause, we heard I think a statistic that said the leading cause of women 15 to 49 was HIV. But I want to remind everyone that the leading cause of death for those 15 to 19 worldwide is complications to childbirth and unsafe abortion. So when we have girls in school, this is the social vaccine. These girls, it's been proven, they are much more likely to get married at a younger age, much more likely to get pregnant at a younger age. So it truly is something we need to invest in. So it was a great segue. So I work at Save the Children. I support adolescent sexual reproductive health programs in about 10 countries right now. But today I'm going to tell you a little bit about one program that I support in Ethiopia. And it is looking at what we call the very young adolescents, the 10 to 14-year-olds, and thinking about their needs, particularly around menstruation and puberty and menstrual hygiene as it relates to their school attainment and attendance. I'm going to tell you a little bit about our approach, and then I'm going to get a little bit into the data related to the conference theme around the data we have around urban and rural differences and what we saw in our baseline study. So this program, we have a four-program approach. The first one, which really is, I think, the most important, is creating community dialogues and community spaces where we bring together mothers and the teachers and those community leaders with the girls to start talking about these issues, starting with puberty and breaking down the taboo. Whenever I do work in adolescent reproductive sexual health, our practitioners in my field know that we have to start with the community. It is the entryway into doing this work, and breaking down those taboos are so, so important. And we can't move forward unless mothers, parents truly feel that they can start talking about these issues with their daughters. So that's our first approach, but most important. Second, and this is all school-based intervention. So the second approach is doing that puberty education. But we do it actually housed within a larger life skills approach. So we really talk about puberty, we talk about menstrual hygiene, menstrual blood management within a larger curriculum where they're also then learning about early marriage, preventing pregnancy, just the life skills that they need to negotiate through some of these issues. The third approach, which actually gets totally underlooked at and underfunded, is we build latrines in these schools. For Save the Children, we truly feel this is a basic human right for every girl and boy who is attending school to have a place they can go to the bathroom. But this problem is so much more profound for the girls. The boys can go anywhere. They go into the woods, it's fine. I can't tell you how many of the schools we work in that do not have toilets at all, especially in Ethiopia. And the 24 schools we chose to work in were ones that did not have toilets, because we wanted to see the combination of our approach if it would increase school attendance. We haven't gotten our end-line data, but I hear it anecdotally from the girls, how excited and happy they are that not only do they have a latrine, but that it's girl-friendly, meaning it has a door, it is separate from the boys' latrines, and they can go in there and they can lock that door and do what they have to do. Common sense, but a huge, it's an intervention I think is really underfunded and totally, totally needed. So that is our third approach. The fourth one, which I'm sure I'm going to start seeing people writing questions after I tell you the fourth approach, but it is exposing girls to sanitary napkins. So they know that they exist, and they know they're in the market, and that it is an option for them if they can afford them. Okay, so now going with the conference theme, this project is ongoing, but we do have our baseline data from 2 years ago. So I went through the baseline, and we actually did disaggregate by age, but we also disaggregated by urban and rural girls, because we are working in the capital in Addis Ababa, and then we're also working in the very rural area. So I wanted to maybe highlight for you, in order to stimulate a dialogue, the data that we have between these two populations. But the one caveat I do want to say about the urban population in Ethiopia, and Ethiopia as a whole, if anyone's ever been there, Ethiopia is a really resource-poor country. When you're even in the capital, when you're there isn't this huge disparity between rich and poor like you see in some of the other countries we've talked about here, like Kenya, South Africa. Oh, there's so many. But really, when you get to Addis, there is that disparity doesn't exist, but there also is not these massive slum areas like you find in some other countries. So the context is a little different. But we did have a lot of differences in the data. So I have my cheat sheet here because there's no way I can remember all these data points. We did a CAP survey, knowledge, attitude, and practices. So I'm just going to walk you as quickly as I can through some of those to get you guys thinking. Around knowledge, we wanted just to have girls assess how they feel about their own knowledge about the menstrual cycle. You're probably not surprised. The urban girls were much more frequently rating themselves of having very good knowledge about the menstrual cycle than our rural girls. And some of the other, we'll get into maybe why they rated themselves. But then we got into the specifics around their knowledge of the signs of puberty and their knowledge of the fertile period of the month. And we actually saw no difference between the urban and rural girls. And these rates were very low. So that question around knowing your fertile time of the month, only 6% of all the respondents actually knew the right time of the month when they were most fertile. So the self-assessment of feeling they have a lot of knowledge didn't actually translate into the actual knowledge questions that we had. And this idea of not knowing what time of the month they're most fertile, to me, isn't a surprise. It is something I see actually worldwide in all of our programs because it's something that we forget to educate about. We talk about puberty, we talk about the menstrual cycle, and then we cut it off from some of the more taboo topics like fertility, getting pregnant, family planning. And they have to happen together. Because talking about puberty, it actually is quite easy, but it is a gateway to talking about more sensitive topics and giving girls the knowledge and skills they need to prevent pregnancy. So I'm not surprised a lot of girls didn't know about that. We also asked, do they know where they can find products in their community to manage menstrual blood? And about the urban girls were 12 percentage point higher than rural girls in terms of knowing where they can get products. Again, not surprising. From their walk from home to school, they pass pharmacies, they pass shops. The rural girls walk through other people's farms to get to school. So they just don't have the access and the exposure. Now going to some of the attitudinal data that we have, we asked girls, do you prefer to stay home during your period? Urban girls were much less likely to report that they wanted to stay home, that they stay home. They were 16% point lower than the rural girls. We also asked the question, I feel I cannot go to school during my period. And these urban girls, they were significantly more likely to continue going to school. 27% points higher, they actually said, no, I feel like I can go to school. That's a huge disparity between just feelings of I can keep going to school when I'm having my period for whatever reasons. Let's get into some of the reasons. We asked about their self-confidence. Do you feel less confident during your period? Again, the urban girls were much less likely to agree. They felt much more confident during their periods. This question always gets me. Are you afraid? It sounds like a weird question to put in this survey, but we talked about it. Are you afraid of your next period? Just curious how the girls would answer. Huge difference. Overall, though, 40% of the girls said, yes, I'm afraid for when my next period comes. That was striking enough. But the rates of the rural girls actually saying that was so much higher than the urban girls. Okay, now just to get to some of the behaviors. 2 minutes, all right? To get to some of the behaviors around going to school, using products, we asked them, during the last 3 months, have you missed school? So there's a huge difference here between urban and rural girls. 80% of the urban girls miss no school. Actually, they reported missing no school during the last 3 months. And of those that reported, the 20%, none of them missed more than 4 days during 3 months. It's not too terrible, actually. You're not going to fall too far behind when you're missing 4 days in 3 months. Of the rural girls, only 55% of them stated they missed no school. And 14% of those that missed school missed more than 4 days during the past 3 months. And that actually went all the way up to around 17 days. So we start to see who's actually missing school when you compare the data. Why are they missing school? We asked them, hoping maybe we'd hear, oh, because they don't have pads, they don't have latrines. But actually, it's sad to hear this, but the main reason why girls don't go to school, and now it links back to the self-confidence and the fear, is because they fear being ridiculed, mostly by boys, when they get to school, and if they have a leak and their clothes are soiled. And actually, I have the data here. Yeah, the rural girls, 73% of those who were feared, the girls who missed school, 73% said that's the reason why they don't want to go. 45% of the urban girls said it was the fear of being ridiculed. And it actually reminds me, a quick anecdote, I was just actually was in Ethiopia about 4 weeks ago, and I was interviewing some of the girls using some of my fun, creative methods that I can tell you some other time. But one of the girls was actually, I asked her to draw a picture of a girl, and she's walking down the street, and this girl sees her friend and says, oh, why aren't you in school? And you only get these cultural nuances when you do qualitative work, right? And so she said, because the boys are going to say, I have the red terror. Of course, I had no clue what that meant. I mean, I thought it was a euphemism, but it actually was a euphemism very contextual. They were referring back to the Derg regime in Ethiopia, which was a communist time, and they called it the dark years in Ethiopia. And I don't think these girls actually understood what the Derg regime was, but that term, the red terror, has been pervasive through the culture. So the boys put red crosses on the girls' stuff, and they say, you have the red terror. The girls hate this. Okay, I'm going to wrap up in 1 minute, about 2 minutes. Let me just talk about discussions about puberty with adults in terms of a behavior, having that discussion. This we actually saw no difference. Again, I'm not surprised because of how taboo the topic is. And overall, there's very low levels in our survey of girls actually talking with adults. 34% of the girls said they've actually ever talked to an adult about these issues. With that, I'm at the end of I got my close, but I do want to end with some actual voices of a parent and a voice of a child, so you can hear this. I'm going to start with the parent. This was also during our baseline informative research. We did some qualitative work. So a parent is saying, one day my daughter came from school. She was bleeding. I lost my temper, and I repeatedly asked her, what did she commit in this school? I suspected she had sex, and I punished her. My neighbor, a teacher, came in and told me that this was her first menstruation. I didn't want to hear her. I know when a young girl bleeds, it's all what we've passed through. And she's referring to, it means I've had sex and I'm going to get married. So just the lack of knowledge, the parents feeling that blood actually meant that they were having sex already. Probably because they were already married at that age, and they were already sexually active. So that's the context, and that's why creating that dialogue is so important for these projects actually to work and to see some social change. And now to end with a voice of a child. We love to do that at Save the Children. Got to end with the voice of the child. When I menstruated for the first time, it was so difficult to manage. For the first time, I discussed this issue with my female friend at school, then with my elder sister. Both assisted me in finding a suitable cloth and how to keep myself clean. My bigger sister gave me the soap and clean cloths for the first time. Afterwards, I learned to manage the process myself. It has been 3 years since I had my first period, and I am open to discussing it even with my teachers. This is a 14-year-old girl in 5th grade. This is our baseline. So she didn't go through the program. I mean, she actually ended up being, this is the goal. This is what we're trying to work towards. If girls had a friend, and even better, an older sister who they could first talk to and then feel comfortable going to their mom or to their teacher, I think we've achieved success. So I'll cut off there. Thanks.
Great, thank you. Thank you very much. I think we're going to probably come back to the issue of intergenerational communication about some of these issues, but now we're going to hear from Dr. Marnie Summer, who's trained as a nurse and has a doctorate in public health. Her expertise involves conducting participatory research with adolescents, understanding and promoting healthy transitions to adulthood, and the intersection of public health and education, gender, and sexual health. Her doctoral research explored girls' experiences with menstruation, puberty, and schooling in Tanzania, and the way in which the onset of puberty might disrupt girls' academic experience. She is currently the executive editor of the Journal of Global Public Health, director of the Global Health Track within the Department of Socio-Medical Sciences at the Mailman School of Public Health at Columbia University. Marnie.
Thank you. Many thanks for obviously hosting this tremendous Congress, and also to Anne for setting up this panel and inviting us all to participate. I feel like I've been extraordinarily well set up by the past two speakers, so hopefully this will follow on nicely to what they've already set the foundation of. Just curious, even though I think the other two speakers have already highlighted a lot of these issues, and I'm just going to bring it out into public the way we are right now. And apologies to the men in the room. I'm grateful that you're here, but this question, unfortunately, will just be targeted at the women for reasons of physiology. But how many women, girls, in this room, let's say in the last 5 years, 10 years, 20 years, or since you were an adolescent, please raise your hand, stop to think about what color clothing you were wearing on the bottom half of your body a certain time each month? Will you just raise your hand? Okay. And how many women, young women, adolescents in this room at some point could feel that menstruation was starting and rushed to the nearest bathroom and or drugstore to buy an emergency supply of tampons or pads? Okay. So this sort of speaks to something that the last two speakers were talking about. When you don't have that cloth or that pad or that toilet anywhere nearby, and or male teachers, and or have to walk a mile to get home through a village with a lot of people staring at you, and uniforms that may be light blue, just like mine were at the private school I went to in Baltimore, and it was mortifying to have to wear a light blue skirt every month, certain days of every month, just in case. And then the last question, how many of you, when you first saw your first menstruation, when you saw blood that first time, thought that you were dying or had a deadly disease? Okay, a lot less hands, and which is nice to see, because some of the research I've done, although there are some tremendous systems of conveying guidance from elder women to young girls in countries around the world, there are also some tremendous gaps in the information that girls are getting prior to that first menstruation. And the thought that they may be dying or that they may get in trouble for having been perceived as having had sex at an early age are very real and exist in many places. So I'm going to talk today to bring that back to sort of an actionable item in the theme of the conference. In 2006 and 2007, I did an in-depth research study in northern Tanzania comparing the experiences of girls in rural and urban Tanzania in school and out of school in terms of how the onset of menstruation and puberty may be interrupting their school participation, their attendance, their completion, all the things you've heard about today. The research methods included observation, in-depth interviewing, looking at curriculum and policy, and most importantly, to what I'm going to talk about today, participatory activities with girls. Because just as Brad underscored, capturing girls' voices is really fundamental to knowing how to solve the problems that they are facing. Going into the research, having worked in global health and having taught in East Africa before, I suspected, just as girls in New York City, where I live, that there would be gaps in what the young girls knew about what was happening in their bodies and potentially how to manage their periods in school, in environments which lack all the things that we've heard about and that often are only having male teachers. So I designed the research in such a way that I would collect information from girls that would both give me data to understand the problem and also could become part of a potential solution. So I had the girls who worked in groups when we did the participatory activities, but also sometimes had homework assignments for us. Write, for example, I collected about 120 menstrual stories, is what I called them. And we asked the girls to write one page anonymously in Swahili, which is what they're most comfortable in, to write about their first period. How did they feel? Who did they talk to, or not? Some of them talked to nobody. How did they manage, and what would be their advice for younger girls? And these one-page stories provided a tremendous source of data, but they also fit into a vision I was having about ultimately publishing a book for girls that incorporated girls' own stories, which is what I'm going to talk about in a few minutes. Another activity we had the girls submit anonymous puberty questions to us. So we would know what are the things that they want answered, that nobody is telling them, that they are missing, and that they want to know the answers to. So we got questions about sex and menstruation and puberty and so on. And that also fed into the book project. The last participatory activity that I'll mention, we asked girls in groups to design a puberty curriculum that we promised to pass along to the Ministry of Education. So we captured what the girls felt was a gap in what they knew and guidance that they felt that they needed. Okay, so I took all this information, and what did we find that was of relevance from this in-depth study? I won't get into the latrine and the water and all those issues that I think have already been highlighted and covered, but the kinds of things that I also thought about is, for those of you who've worked in these schools or observed these schools, teachers are overloaded. The curriculum is very full. They don't necessarily have reference materials. They may be all male. And so my sense was this is not a task that we can pass along to teachers to ask them to, at this point, start teaching more about puberty in a way that will necessarily, and how to manage your period comfortably in a way that would work with girls. I noted in terms of the themes of this conference, rural and urban differences. Because of urban migration, because of HIV/AIDS, families are separated. And traditionally, at least in Tanzania, it is the aunties, the paternal aunties, the grandmothers, the older women who convey puberty guidance to girls. It's not the mothers. There's a taboo about mothers speaking about this topic. But families are being separated. So as mentioned, girls don't necessarily have that guidance, particularly girls in urban areas who've gone and are living in more of a nuclear family than they were living in before. Not to say some mothers don't talk to their girls, but this change in the family structure is leading to an additional gap in the information girls are experiencing. And it's also a sensitive topic. There's still a huge amount of secrecy talking about menstruation. Just as parents in America, I have to say, I think are still pretty uncomfortable sitting down and talking about menstruation, parents in Tanzania don't really love to sit down and talk about menstruation. And so these are sort of the things from the study that led me to be convinced that publishing a book for girls was a really good idea in terms of empowering them and helping the parents and the teachers to open the dialogue. So I fortunately received some seed grant support from the Nike Foundation to develop and publish this book in collaboration with local colleagues in Tanzania. This is the book. The book is divided into 3 sections. The first section is very, very basic puberty guidance developed from a puberty curriculum that the government was already working on. And so we lowered it to the reading level of 10 to 14-year-old girls. And so the first part of the book, and it's all very colorful, and you can see it at the end if you're interested. So the first part of the book is puberty guidance, not getting into safe sex, not getting into HIV, not getting into family planning. This was a book to reach girls at that early window before they're dealing with some of those other pressures. And also, ideally, a book that could be flooded across the country and not upset parents, because we're just targeting that early puberty age and not talking about something that make parents more uncomfortable. So the middle section of the book is, we picked 5 of the 120 stories. We put 5 that were somewhat diverse into the middle of the book. And then the end of the book, I have to say I went to Barnes & Nobles and looked at all these preteen books that didn't exist when I was a child, and got ideas for activities. So it teaches them, because the girls were afraid, as mentioned, when is their next period coming? So we teach them how to keep a menstrual calendar. We have activities, true, false, so we could help to counter some of the myths that they had heard about menstruation. We have question and answer sections to help answer some of those anonymous puberty questions that they submitted to us. So this was the book. I feel it's very important to invest in the local economy and to have it contextualized. So I hired a terrific Tanzanian illustrator, translator. The book is Swahili and English on every single page. Swahili so they will understand it. English because they have to learn that in school, so why not give them the English so they can practice? And we pre-tested it with the most patient set of 11-year-olds I've ever met in my life. They sat with us for 3 solid hours and went page by page and told us when the pictures didn't match the Swahili and when the Swahili made no sense or the English made no sense. And so I then patiently went back to our illustrator and said, sorry, this picture doesn't work. And went back to the translator and said, sorry, the girls have no idea what you're talking about. You need to change it. They don't use this word. And it's critical. Obviously, you need the young people's input. And then, kindness of the Nike Foundation, we were able to publish an initial 16,000 copies, which we distributed through various non-governmental organizations working with 10 to 14-year-olds in Tanzania. Subsequent to that, and I'll wrap up just really quickly, I had been banging on the door of the various UN agencies and US government who I used to work for, trying to get funding for this idea for 3 years and got nowhere. Once the book existed, and I slipped a copy to the permanent secretary of the Minister of Education because I had a number of colleagues in the ministry, and then I went to meet with him with my colleague, he couldn't get over it. He had read it, he was teasing his granddaughters, that made me a little worried. But most importantly, he loved the book and said, I want our curriculum committee to approve this and to review it. So we received conditional approval from the ministry in November, and I'm fingers crossed we'll have final approval in June. Suddenly the book is out there, the ministry likes it, so I get a call from UNFPA Tanzania in December saying, we'd like to publish some copies of this book, and so another 42,000 copies were published. UNICEF Tanzania now wants to publish another 42,000 copies, and the mobile phone companies whose doors I was banging on a year ago to try and get support are now emailing me that they may be interested, and in fact the US government may fingers crossed, be interested. So, so that's been extremely exciting, and if only I can find the funding, I would love to see these happen in countries all over the continent, because I just think it taps into this thing that people want. The parents want it. My taxi driver couldn't get over it. His whole family, every extended member has it now and is opening this conversation between aunties and daughters and so on. So I just want to end, before I get in trouble, with sort of 3 things that I think are really critical for this kind of project. One, it really needs to be socially and culturally appropriate to the context in which you're working. The only reason I think this book has done well is the stories and the questions in here came directly from Tanzanian girls. So I think it speaks to them, and I think it speaks to their parents and their teachers when they read it. It's empowering to girls. I think it's critical that you empower girls through the solution. And so I think having girls be an integral part of producing a book like this is really critical. critical. And lastly, parents and adults are as well obviously extremely important in the lives of young people. And so you have to come up with something that is not going to lead a parent to get angry at the child or angry at something being introduced that doesn't fit in the society. And so making sure that whatever you do is reviewed by adults as well as young people, I think is critical, so that I feel very comfortable sending 100,000 copies across Tanzania, because I know that the parents that have reviewed it and the teachers think it's fine. So thank you very much.
Thank you. Thank you very much. Our final speaker is Shweta Shukla. She's the head of the external relations function and part of the Procter & Gamble executive team in India. She is, as you will hear, deeply committed to children's education, and in fact was responsible for a program called Shiksha. I almost got the pronunciation right, but doesn't mean what we think it means here. It means education. And through that program, which only began in 2004, it's touched almost 100,000 children in India. She has also been deeply involved in a program, a public-private partnership between Procter & Gamble and the government of India that is focusing on using community health workers to be a link between young rural women and some of the services they need, including sanitary napkins and other hygiene products. So it will be great to hear about those programs. Shweta earned her MBA from the Narsi Monji Institute of Management Studies in India. Marcy, I'm sorry, Shweta.
Thank you, Anne. I hope I'm audible. Thank you very much to the ECOHE management here and Procter & Gamble for giving me this opportunity. I feel very inspired and humbled at the same time to be amidst all of you here today. So, a very good afternoon. I come from India, and India is a land of stories. Oral narratives have chronicled our times and our history. So I think it's only appropriate that I adhere to tradition. So let me zoom all of you out of this room, out of the US, and take you into the far-off land of Rajasthan in India. In the short time that we have here today, on this subject, I'd like to actually weave together a number of stories that we encountered in our work into one story. And the protagonist for the day is a 15-year-old girl, Banwari. Banwari comes from the state of Rajasthan, which is a desert state in the western part of India. It's largely underdeveloped, barring some of its cities, which ironically are global tourist destinations. Jaipur, Udaipur, you've probably heard of some of those cities. It is also a state which has a reputation for gender inequality and patriarchy. Banwari is the oldest of 6 siblings, and she's grown up believing that she needs to take on more and more household chores. For example, walking barefoot to the nearest well, which is about 4 hours away, and fetching water on her head for the entire family. Banwari's father finally decided to enroll her into a nearby government school, which does not cost him any money. And those few years, Banwari started living the life of privilege. She loved being in school, being with other girls, playing with them, giggling all day. But all this changed one fine day when she started menstruating. To begin with, when she started bleeding, she was clueless about what was going on. She sat in a corner totally mortified. Finally, when her mother noticed that her yellow kurta was stained red, she quickly brought a piece of an old sari, which the mother herself was using for her own menstruation, stuffed it with some sand, because it's a desert land, remember, and some cotton, made it into a pouch and said, "Banwari, here you go. Now go get some rest and make sure you don't enter the kitchen or visit the temple because you're impure." This became a monthly ritual for Banwari. The cloth bag did not stop the leaking or the staining or even the subsequent infections. In school, there wasn't enough water to wash the cloth or a private place to change it or for her to wash her hands. Banwari's parents decided she was better off not going to school. "We don't want the men in the village to know that our girl is now grown up," said her father, and her mother silently agreed. Banwari could be any of the 80 million rural adolescent girls in India. Kofi Annan, and I quote him once again, he said, "If we want to succeed in our efforts to build a more healthy, peaceful, and equitable world, the classrooms of the world should be filled with girls as well as boys." Yet, in India, for every 100 boys, only 83 girls see the insides of a school, and the statistic gets worse. It's 76 girls for every 100 boys as they approach adolescence. Now, there are several reasons why school attendance starts depleting at the secondary level for girls. To begin with, as Varina said, it's poverty. It's also in India the pressure to marry early. It is the lack of basic amenities like toilets. And most importantly, it's the onset of puberty with the complete lack of knowledge of what's happening to your body and the access to quality sanitary protection, just like we saw in Banwari's case. Well, recognizing all of these challenges, P&G, Procter & Gamble, initiated its program called Protecting Futures, supported by its sanitary napkin brand Always, which is called Whisper in our part of the world, in Asia. Protecting Futures is actually a part of our global philanthropic program called Live, Learn and Thrive, where we aim to provide millions of children across the world either get off to a healthy start or access education or build skills for life. Protecting Futures specifically focuses on keeping girls in school in underdeveloped markets, specifically 17 markets, 16 in Africa and India, where we recently started this program. We do it via two pillars. One is providing puberty education, and the second is providing access to quality sanitary protection. Let me share with you the India experience, and as I do, I want to be upfront that with a population of 100 million adolescent girls, urban and rural put together, we have only scratched the surface and we are still learning our way. Let me start with the puberty education program that we are running in India. When we first launched Whisper way back in 1990, it was a hush-hush category. Sanitary napkins were not even allowed to be advertised on television. Nobody was talking about it. At that point, we took the first step of going and talking to school principals in government and private schools and convincing them for the need to talk about menstruation to the schoolgirls. And since then, we've been doing a Whisper mother-daughter school program. It's important to also involve the mother and integrate the knowledge with both of them together. Till date, our entire team of about 300 trainers has reached 8 million girls in 14,000 schools in over 750 cities and towns in India. And I can tell you what a difference it makes for the mother and daughter to be together and to get this knowledge on feminine biology, menstruation, the usage of sanitary napkins together. The second aspect, which is providing affordable sanitary napkins, is pivotal for not letting girls to lag behind boys when it comes to education. In India, we took the first steps about close to 2 years ago. It was about August 2008, when we first started talking to the Ministry of Health. We partnered with the Ministry of Health in the state of Rajasthan, where Banwari comes from, on a project called Parivartan. Parivartan in English means transformation. This is a pilot in 3 districts of Rajasthan that covers 360,000 menstruating women, roughly half of who are adolescent. Neither our puberty education program or our product had made inroads into these districts of Rajasthan until Parivartan started. In our initial field work with village doctors, we were made aware that women often use materials like sand, coconut husk, hay and grass, practically anything that absorbs for sanitary protection. And the reason for adopting these sub-hygienic practices was not just affordability or the lack of awareness that sanitary napkins exist, but also accessibility. Women, especially adolescent girls, were shy to walk up to a typical store in India, which is like a small mom and pop store, and ask the male retailer for a sanitary napkin, because she didn't want the men in the village to be aware that she's now post-pubescent or sexual. So, in partnership with the National Rural Health Mission, which is a part of the Ministry of Health in India, we worked with their government health workers called ASHAs. ASHA is an acronym that stands for Hope and can be expanded to Accredited Social Health Activist. Now, these are women who go to households daily talking about immunization, contraceptives. They're trained government staff, and they're a source of trust and knowledge for women already. So we train them to provide education on sanitary napkins and the product itself at a subsidized rate to girls inside the private confines of their homes. In parallel, government health centers are being used as converging points for distribution of product, training the ASHAs, and reinforcement by the resident doctors on the need to use sanitary napkins. In addition, the government aids in spreading the message via radio jingles, posters, wall paintings, all of which are rural relevant media. So far, we've been encouraged by the response. In an independent survey conducted by the Nielsen Company, we learned that almost 85% of the girls and the women who were exposed to Project Parivartan have now moved to using sanitary napkins versus the traditional methods that they were using. And the ones who are not still using them regularly are far more aware about the concept of menstruation, their own bodies, and a lot of the myths and the barriers have been busted. Well, while all these statistics are nice and intriguing, all of you are wondering what happened of Banwari, our protagonist for the day. She had reconciled to the life of being at home until one afternoon an Asha, the community health worker, came knocking at her door. She wondered, why is this lady who talks about contraceptives and pregnancy coming to my home? Well, she had this little pack of Whisper sanitary napkins. She opened one, she showed it to Banwari and said how this compact looking thing is actually better for longer lasting protection, absorption, and can avoid staining and embarrassment. Banwari's mother stormed in and tried to shoo away the Asha, saying that they didn't care for these newfangled ideas and she'd rather spend that extra money on more food for her family. Banwari discreetly signaled to the Asha and asked her to wait for her outside her house. Banwari showed up, bought her first pack of sanitary napkins, went home, dug a little hole outside her house, and stored the pack of sanitary napkins inside that hole and covered it with sand so that her parents wouldn't know. But the Asha, being the responsible health worker that she was, kept coming in regularly and educated the mother on why it's important for her to see the benefits of sanitary napkins versus the traditional means and how it was worth the trade-off. Finally, Banwari did not have to hide her pack anymore. She went back to school, and when we asked her what she dreams of, she said that she wants to become an English-speaking tour guide in Jaipur. With that, I come to the end of my story. I think it boils down to this: we need girls to progress. It is obvious that investment in girls' education has positive social and economic implications, which is why PNG's Protecting Futures is working across the developed world and developing world to provide access to quality sanitary napkins and puberty education, hoping that with that girls will not be afraid to go to school and will do their best to change the world. And if you ever happen to visit India and Rajasthan, I do hope you bump into Banwari as your tour guide. Thank you.
Okay, thank you. Thank you very much. As was inevitable, I've got a lap full of questions, and we don't have much time, but they're so interesting, we'll try to squeeze as many in as possible. Marnie, one question that's come up is, the book sounds so useful. What are you going to do to make it available in other countries? And what is it going to take to do that?
Well, money. It would be the simple answer. I would love to do this. I've actually had requests from a large girls' education organization in Zambia, in Eritrea. UNICEF has offered to help pay for part of it. I've had requests come in. Brad and I have been talking about this for his project in Nepal and possibly Ethiopia. So presuming I can, it comes down to continuing the effort to try and find funds to do it. You know, the first one, it's interesting that it was daunting at the beginning, even though I knew I wanted to do it. And one of my former students from when I taught in Eritrea, he and I still email 17 years later. And I was emailing him that I was struggling to try and do this book. And he emailed me. He's very wise. He's 15 years younger than me. And said, Teacher Marnie, because he still calls me Teacher Marnie, if you can just do the first one, you'll know how to do it and the others will be easier. And he was absolutely right. I know exactly what to do now. It's just, you know, the eternal quest. So. Okay, great.
Another question that actually could be addressed to anyone on the panel, but I will choose to address it to Rina, who's done so much travel. What would you say are the essential elements of a girl-friendly school? What would you look for to say that this is going to be a positive experience?
A girl-friendly school means, and Brad also touched the issue, safe and separate, private sanitation facilities, close to a school where girls are not afraid to go to toilet facilities. We also have to take care of the school, what do you say, where children sit on the banks, and because for example in Kenya, I heard that girls have to lift up their feet if they want to sit into the school bank, and if you have a girl who is menstruating, it's horrible because otherwise, you know, people can see that. So those are the two things that are important. May I mention that another thing of a school, female school-friendly climate is that we also have to take care of the teachers, because there are a lot of teachers who are female, and some of them have to rush to their home to change. In some areas, and for example in Nepal, they have to remove themselves from public spaces, and that is very, very female unfriendly.
Great, thank you. Maybe to our two researchers who've worked in Africa, Brad and Marnie, if you could address this. In working with and promoting adolescent reproductive health in young girls, is the topic of genital mutilation ever discussed? And can you talk about how this can affect their reproductive health? And how do you promote reproductive health empowerment?
And I can touch on it. It's a challenging question, but definitely relevant. At Save the Children, we don't necessarily take on this issue as much as we should, but I do know other organizations that are and can direct you to those organizations if you're interested. But I would go back to the first pillar of our programming. When you're dealing with FGM, it really does start with community mobilization, getting communities to see the negative consequences of this, to publicly announce that they won't do this in their village, and that takes time. And you have to work on a much smaller scale, I think, when you're dealing with these types of issues. It's not something you go to scale really quickly. So the one organization I know who does this really well, their name is Tostan, in Senegal, and they work village by village, and somehow they've convinced their donors to say, if I need 6 months to 1 year in one village, and we have to do that. But what happens is they get a tipping point. They go from one village, and the village publicly announces that they won't deal with this. If you do this to your daughter, we have consequences, or they have their own ways of dealing with that. They move to the next village, but each subsequent village, it goes faster and faster. It's kind of like the tipping point. So in terms of I'll leave it at that.
I don't have a lot to add. What I would say just sort of follows what Brad is saying. I think people have been trying to address this issue a long time, and as he said, it's quite complicated. And there are camps and West versus, there were a lot of opinions, but 100% support. It has to come from the people in the country, in the communities, men and women. As a Peace Corps volunteer in Eritrea a very long time ago, it was eye-opening for me to learn often it was the women and not the men who are perpetuating or continuing to support it. But 15, 17 years later, just to emphasize this point, I was just back in Eritrea last February and back in my old village, and the National Union of Eritrean Women has steadfastly been working on this for 15 years, and they had just had the legislation passed to make it illegal. So at the macro level, at the policy level, that obviously doesn't mean anything on the ground, but it is an important step. And then in that same period, I went and traveled to my old village, and they had it was FGM or FGC is what they call it, FGC Day, or anti-FGC Day. And there was a community under the traditional daro, which is this magnificent large tree where the elders used to gather and still do to make important decisions. The National Union of Women had called all of the important elders and villagers, the priests of the Orthodox Church, the Catholic Church, the Muslim imam. They had all come together. All these men got up and spoke, these religious figures. Different people from the community got up and spoke. The young people did dramas to emphasize why it wasn't important. And then at the end, the Saho women, who are a tribe from an ethnic group from southern, just south of where that village was, stood up. They were all former cutters. And they stood up and made a public oath, about 25 of them in their colorful sarongs, that they would no longer cut. But they need to be educated, and they need to be offered alternative sources of income, because that is who they are, it is their identity, and it is their income. So it's really, as he said, a complex but community-based approach that I think you need to take.
Right. Thank you. There are a couple of questions that I will address to Shweta. And one person here said, I'm convinced of the importance of providing sanitary napkins, but I wonder about bringing disposable products into these communities. Is there any movement to provide reusable pads or other products that environmentally may be more useful in the community?
I think it's a very valid question and something that we've taken cognizance of. We did our environmental risk assessment before we started this program, and what this assessment showed us was that we were not making a significant adverse impact on the environment, and really the benefits of using sanitary napkins were much, much more than some of the traditional unhygienic means that women were using. Also, in countries like India, you need to remember that the other aspect of environment with using cloth, etc., is the whole burden on water. Not necessarily all the villages have as much supply of water, or there's even hygienic water to be able to wash that clothes. So it's really a trade-off between the impact on water from an environment standpoint or the impact on land when it comes to disposable sanitary napkins. We did an assessment which showed us that the overall solid waste was less than 0.05% that sanitary napkins are generating today in India. That's the entire industry put together. So yes, it is significantly a smaller problem right now, but we cannot sidestep the issue. Going forward, we are looking at what we can do for better solid waste management in partnership with on-ground NGO partners and the municipalities.
Very interesting. Here's a question that's addressed to all panelists. You don't all need to respond, but you probably all have opinions about this. But the question is, in your work to educate young girls about menstruation and efforts to implement facilities or programs, where have you found the greatest resistance? And what have you done about it? Yes.
I will give one example because I did research amongst very old women from Suriname, a group of 55 plus and a group of 75 plus. And the group of 70, one of the women in the group of 75 plus told me about the introduction of Tampax in Suriname. And she was happy with the introduction. And her grandmother said, "No way, it is not entering my door." So, just like Marnie, the people we have to convince, because young women want to go on and have the progress and use products that are new. It's the old women who block.
Yes, Brad.
I'll add to that. For us, I kind of keep saying the same point, but for us it's been religious leaders because they weren't properly engaged. We identify the right religious leaders, but they do have such importance in their communities, and they're not against these issues, and you actually can make such links to both the Quran, the Bible, whatever it is, around all these issues. Family planning, there's great links, and they love to learn about those so they could use it. But usually resistance comes from a lack of participation. And then the two other people is, one, the girls themselves, because the resistance comes from, why aren't you teaching the boys this? They need to know this. And that's valid, and I'm always trying to convince our donors I buy into this idea of the girl effect that Nike Foundation is promoting right now, but trying to also convince them that part of the equation is working with the boys. And then the boys themselves, because they say, we want to know about this. How are you going to come into our school and only work with the girls? We want to know about this stuff. So you have to work with everyone.
Right. Great. Well, I can see our time is up, and I'll just tell our panelists that they've ducked one of the really more interesting questions, which is, how do you apply some of this to the problems here in the U.S.? Because we have some of these very same issues, but we're not going to deal with that now. Let me, before we close, just thank the panelists for a wonderful discussion.
So I want to